Measuring blood pressure at home, in simple steps. Did you know that blood pressure is the force of blood against the walls of the arteries, when the heart pumps blood throughout the body, and is considered one of the vital signs that indicate the health of the heart and circulatory system? Blood pressure consists of two numbers. The first one is the systolic pressure, the upper number, and it is the pressure in the arteries when the heart beats and pumps blood forcefully. And the second is the diastolic pressure, the minimum number, which is the pressure in the arteries when the heart rests between beats. Usually, there are differences in blood pressure readings between the right and left arms, which it can reach up to 10 mm of mercury sometimes, and this is considered normal, but differences that exceed that should be discussed with your doctor. What are the guidelines for measuring blood pressure before and during the measurement procedure? Avoid caffeinated drinks, exercising, or smoking, at least 30 minutes before measurement. Sit quietly for 5 to 10 minutes, with your back supported, and your legs in an upright position directly on the ground. Place your arm outstretched in a comfortable position at the same level as your heart. Place the air belt over the upper arm, 2 to 3 centimeters above the elbow. Do not speak while measuring and record your readings.
What are the blood pressure classifications?
The blood pressure classified based on two measurements. First is the systolic blood pressure measured in millimeters of mercury, and it is the upper number, numerator, and the second is the diastolic blood pressure measured in millimeters of mercury, and it is the minimum number, denominator. Blood pressure is considered normal when the systolic pressure is below 120 mm of mercury and the diastolic pressure is below 80 mm of mercury. It is classified as elevated when the systolic pressure is between 120 and 129 mm of mercury, while the diastolic remains below 80 mm of mercury. If the systolic pressure is between 130 and 139 mm of mercury, or the diastolic is between 80 and 89 mm of mercury, this indicates high blood pressure, hypertension, stage 1. Stage 2 hypertension is diagnosed when the systolic pressure is 140 mm of mercury or higher, or the diastolic pressure is 90 mm of mercury or higher. A reading of systolic pressure over 180 mm of mercury and or diastolic pressure over 120 mm of mercury is classified as a hypertensive crisis.
The Al Musa Health Patient Education Team wishes you continued good health.